So maybe you could tell me how it's possible to be able to understand speech in a noisy environment while wearing hearing aids, but not be able to hear someone in a quiet office. Hey guys, welcome back to the DrCliffAuD vlog. So I don't know if you have this particular problem with your hearing aids where you go into noisy environments and you feel like you can hear and understand everybody without a problem, but then you find yourself inside of like a doctor's office and you tend to struggle understanding your doctor. It really makes no sense unless you understand acoustics, right? So let me kind of explain the issue here. And this was actually a comment that was left inside of the phonic hearing aid community. So this individual asked, does anyone have this specific hearing problem? I'm actually okay hearing in loud places with my Sphere hearing aids, but it's when I'm in silent settings, in conversations, that I can hear they're saying something, but I can't understand what they're saying. Other hearing aids have been the same. For example, I was sitting in a hospital room, no machines beeping or anything like that, and the nurse and doctor stood face to face with me talking one at a time, couldn't understand a word. I had a tradesman in my house in a totally silent setting, and I had to keep asking him to repeat. It's making me very anxious. My hearing is moderate to severe. So, the number one concern that people have when it comes to hearing aids is being able to hear in a noisy environment. So I would expect to hear that if someone's struggling in a quiet environment, that they're also struggling in a noisy environment, but that is not actually what's happening here. So if this is you, you really need to pay attention to this. In fact, you should really pay attention to this even if you struggle in background noise and in quiet situations, because there is a very clear explanation for this. So number one, when a hearing care professional is programming hearing aids for you, they need to make sure that they're programming in compression. What is compression? Well, compression basically means that they need to make sure that they're applying enough amplification to soft sounds to bring it into your audible range, but reducing the amplification to loud sounds to make sure that those are comfortably audible for you. But the point here is with compression is that you're trying to compress loud speech and soft speech into your audible window. When programming a pair of hearing aids, hearing care professionals have the ability to separately adjust the amount of amplification that you're getting for soft level sounds, average level sounds, and loud level sounds, so they can do compression, okay? So when you have someone going into noisy environments, the most important thing there is that we need to make sure that we're matching your loud level prescriptive targets and verify it with real ear measurement. If we do this, we make sure that your brain has access to the speech information and can separate that above the noise that's in the background. Now, there are other things that you need to measure with this, so you need to know what your signal to noise ratio loss score is, so we know how much additional amplification you need above in decibels above the background noise before you can understand what they're saying. You need to make sure that the maximum power output is high enough to make sure that we're not compressing down on the amplification for loud level speech. But generally speaking, we can maximize your performance in background noise with good hearing aids. This individual has very good hearing aids for background noise, as long as we focus on loud level amplification and loud level compression. Now, on the other side of this, when you go into a quiet environment and you're talking to someone who's a soft talker and you struggle with them, essentially what that means is that you need to have more compression on soft level sounds, or increase the amplification allocated to soft level inputs coming into the hearing aid. So to cite this individual's example, you have like a plumber at your house and they're soft spoken and you're in your calm, quiet, controlled environment without the TV on or anything like that, and you're struggling to understand what they're saying. Basically what needs to happen here is that your hearing care professional needs to increase the amount of amplification given to soft level sounds. Now, when I'm inside of my clinic and I'm taking a patient through an Applied 360 fit protocol and we're doing real ear measurement with them, I make sure that we match their soft level prescriptive targets to make sure that the soft level speech information is audible to them so they can have a shot at understanding it. And then I actually play a passage in English, in my clinic at least, play them a passage at a very soft level, and I gauge how much of that they can actually hear and understand. If they tell me that they're like, listen, I could only understand 50% of that because it was at a very, very soft level, then I need to go into the compression settings and increase the amount of amplification I'm giving to soft level speech information, and then I run it again. And if they're like, oh my gosh, like I could hear that way better the second time around, that tells me that they needed more compression than what their prescription called for. Now, there are rare circumstances where we get into this realm of needing to overly compress sounds, meaning I'm essentially taking this full audible range and I'm compressing it way too much because I have to increase soft level gain and decrease loud level gain so much to the point where it makes it sound unnatural. And that is something that we don't want to do. So sometimes you have to make a trade-off decision here. Do I want to make sure that I'm hitting my loud level prescriptive targets or my soft level prescriptive targets? And this really comes down to the desires of the patient. Now, you can set up multiple different programs for this. So you could have a separate program that focuses on increasing amplification for soft level talkers, and then they can switch into that program when they notice they're having difficulty. In this individual's case, they could literally go into that doctor's office or they're communicating with this tradesperson who's at their house, switch into this heavily compressed soft level speech program and be able to understand the person who's talking to them. But then when you go into more of a noisy environment, you go back into your regular program settings or go into your loud compression program settings so you can optimize your speech understanding and background noise. Now, there are a couple of other variables that go into this. Shocker, I mean, audiology is very complex. If your hearing care professional does not have a really good grasp on all of these concepts that I'm talking about, you might be going to the wrong audiologist. But keep in mind here that we do word recognition testing, so your WRS, word recognition score, on your audiogram will indicate what percentage of speech that you will understand in a quiet environment. If you're up in the 90% to 100% speech understanding, then quiet situations should not be an issue for you. But if your understanding is down around 50% or lower, I mean, we can compress sound all we want all day long. You're still going to struggle understanding someone when they're talking to you. And the same is true when it comes to noisy situations. The worse your word recognition score is and the higher your signal to noise ratio loss score is from speech and noise testing, the more that you're going to struggle in those noisy environments. But that's what we have remote microphones for. There are other assistive listening devices that you can use to optimize your ability to understand speech in a variety of different situations, not just loud level situations and soft level situations. There is also the rare circumstance that this individual might have auditory processing disorder, but I don't think that that's the case here because if they did, they would break down when they go to a noisy environment. So chances of them having APD is very, very low. But that aspect of it should not be ignored by a hearing care professional. If someone is not achieving the level of success that we would expect, as long as we follow comprehensive audiologic best practices, then there has to be another explanation for it. And sometimes that explanation is that they have a processing disorder. Now, if you're really looking to optimize your performance with hearing aids, you really need to make sure that your hearing care professional is matching your prescriptive targets and verifying it with real-ear measurement. If they don't do real-ear measurement, then basically nothing that I'm telling you right now will help you at all. So you have to make sure at a bare minimum that your hearing care professional is performing this verification measure called real-ear measurement. Now, I have a ton of other videos on that. If you want to go check them out, by all means, go and check them out. But if you are meeting your prescriptive targets and you're still struggling, you can do auditory training through like the Lace AI Pro app. I will put a link to the Lace AI Pro app in the description. It does have a fee to it, and I'll put a discount code in there for you to make it a little bit cheaper for you. It's a lifetime license. You can use it whenever you want to. But if you're struggling to hear and understand speech with your hearing aids and everything has been optimized by your hearing care professional, let's say that you've gone to a Hearing Up network member, you go to hearingup.com, find a network member in your area. They are going to follow best practices with you to ensure that you can hear your absolute best with your hearing aids. But if you need a little bit more, then you can do auditory training on top of that using the Lace AI Pro app to make sure that you're hearing your absolute best. Now, I did leave my response on this individual's comment. Hopefully they go back to their hearing care professional and they start asking them questions about them meeting their prescription for loud level and soft level speech targets, and that they have their hearing aid programming verified using real-ear measurement, because if they do, I can almost guarantee that this individual is going to hear substantially better in a quiet level environment if they're already having success in background noise. But I want to hear from you. Do you actually know if your hearing aids have been programmed to compress sound properly by making sure that you're matching your loud level and soft level prescriptive targets? Let me know down in the comments section, and I'll see you next week.